Hello, I'm Dr. Brendan McKenzie and I'm the Skept Vet. Today I want to try to answer a question that I sometimes get from clients, which is there a blood test for cancer, and if so, should my dog have it? Now this question is coming up more frequently lately because there are some new tests becoming available for veterinarians. And the purpose of these tests is to identify cancer in the body somewhere using a simple blood sample before that cancer is detectable in any other way, before there's an obvious lump or before the dog has any clinical symptoms. Now this sounds like a great idea because we think if we are able to find cancer at an earlier stage, we might be more successful at treating it. That isn't always the case, but it turns out that whether or not we should use these tests is actually a little bit complicated. So let's get into it. Unfortunately, cancer is quite common in dogs. In fact, some evidence suggests that as many as a quarter of dogs will develop cancer at some point in their life. Now, there are a lot of potential reasons for this, but the most significant is actually a good thing, which is that our dogs are living longer. We know that humans have dramatically extended our life expectancy by treating diseases that used to kill us when we were young, things like malnutrition or infectious diseases or trauma. So better nutrition, better health care, medicines, better sanitation, all of these things have contributed to people living a lot longer. Of course, the consequence of that is now we tend to get diseases of aging, things like cancer. There's not a lot of evidence in veterinary medicine, but the little we have suggests that the same is true for dogs. This recent study, for example, looked at a large population of dogs in the United States, and they found a small but consistent increase in life expectancy over time. So it seems likely that, like humans, dogs and cats are living longer because we're taking better care of them when they're young and avoiding early life causes of death. Unfortunately, this does leave them more likely to develop cancer as they get older. Now, the way that cancer is usually identified is either a dog will come in with a lump of some kind, maybe on the skin or even internally that the veterinarian can feel on an exam, and we'll test that lump in some way. We'll take what's called a needle aspirate or a biopsy, and that will tell us if it's cancer or not. The other way that we tend to diagnose cancer is when dogs develop symptoms. Maybe they are not eating well, or they're losing weight, or they just don't feel good. And then we go looking for a cause, usually using some kind of imaging like x-rays or ultrasound, and eventually we find cancer. It's quite common to test healthy people looking for cancer before it shows any clinical symptoms. And this is called screening. We do this with colon cancer. We look for colon cancer by doing a colonoscopy on a regular basis. We use a biomarker called PSA to test for prostate cancer in men before they have any symptoms. We use mammography to look for breast cancer in women. We've found that sometimes these tests are useful because they help us to detect a cancer earlier and treat it more effectively. And sometimes they're not useful. It turns out that sometimes they give us the wrong answer. And this is bad because then people get a cancer diagnosis when they don't actually have cancer, and they suffer from anxiety and stress and from unnecessary follow-up tests or treatments for a disease they don't actually have. Sometimes we get what's called overdiagnosis. This is where we diagnose a cancer that actually is present, but it turns out it's not ever going to cause clinical symptoms. Some cancers are indolent. They're slowly progressive, they don't change, and they never make a person or a dog sick. If we detect an indolent cancer, there's nothing we can do about it, and in fact, further testing and treatment is only going to be harmful to that patient. There are some new tests available in dogs that can be used the same way. Something called liquid biopsy. This is a test where you take a blood sample from a dog and you look for biomarkers of cancer, things like bits of DNA that break off from a cancer cell. And the idea behind this is you can take a healthy dog that has no symptoms, no masses or lumps or bumps, and test them. And if they have cancer, you can go and look for it, confirm that it's present, find it, and treat it earlier, and that dog will live a longer and healthier life. This is a great idea, but unfortunately we don't know for sure yet if these tests actually lead to this outcome. Just as in humans, there are a couple of ways these tests can go wrong. Sometimes they're not accurate. For example, in this study, this test was used in both dogs who were suspected to have cancer and in dogs who were not suspected to have cancer, what we call screening testing. And in the screening tests, about 75% of the dogs who tested positive for cancer turned out to have cancer, which means about 25% of them didn't. Almost a quarter of the dogs we tested didn't actually have a cancer that was ever going to be significant or cause them health problems. That's quite a few dogs. If we start testing everybody's dog every year for cancer, we're going to give false diagnoses to a lot, and that's going to potentially cause harm. The other problem, as I mentioned, is that there are cancers that don't progress, that never become clinical. So if we detect diseases like that even earlier, we are potentially putting these patients at risk with unnecessary tests and treatment. So the question again is there a blood test for cancer? And the answer is sort of. There are blood tests that can detect certain kinds of cancers, though not all cancers, and that are pretty good but do have some flaws. The second part of the question is, well, if there is a blood test for cancer, should my dog have it? I would say that these tests are most likely to be useful in dogs where we already have a suspicion that cancer might be present because of clinical symptoms, but we aren't able to find it or diagnose it in the usual ways. I would be very cautious about using this test to screen otherwise healthy dogs for cancer when there's no reason to think that they have it. It's very possible that we will have false positives where we will tell people their dogs have cancer when they don't. And it's also possible that we will have overdiagnosis, where we find cancers that are not ever going to be clinically important, and then we put dogs through a lot of unnecessary testing and treatment. So until we have a better idea of how effective these tests actually are at improving the lifespan of dogs with cancer, I would be very cautious about using them, and I would have a conversation with your veterinarian about whether or not these tests are appropriate for your dog. This is a big, complicated subject, and if you're interested in more detail, I have several articles that I've written on the SkepVet blog and in other places, and you can go and look there. I'll put the link down in the comments. Thank you for watching.